This is the case of isolated right ventricle myocardial infarction. You can see this IVC is prominent. Here, what is this? Is interatrial septum, lipomatous hypertrophy of interatrial septum, dumbbell appearance. This is right ventricle. This is localized trivial pericardial effusion. Again, you see this is right atrium. This is right ventricle. You can see this portion of right ventricle is akinetic and trivial pericardial effusion localized here. So this is the case of isolated right ventricle myocardial infarction, quite rare. Patient has history of chest pain and troponin test is positive. Again, you can see this is subcostal view. This is right ventricle. This is right ventricle free wall. You see this portion is akinetic. So this is right ventricle myocardial infarction. Again, you see this portion, the basal 1/3 of free wall of right ventricle. You see this portion is having good motion, but this portion is akinetic. So this is the case of isolated right ventricle myocardial infarction. You see the size of inferior vena cava, slightly prominent in size. This is IVC. The cursor is in IVC, and this is aorta. So size of IVC is close to that of aorta, indicating prominent inferior vena cava. So this is isolated right ventricular myocardial infarction, and this is dumbbell shaped hypertrophy of interatrial septum, lipomatous hypertrophy of interatrial septum. This benign finding does not carry any significance, only it is usually seen in obese patients. So this is the case of right ventricle myocardial infarction. Here the left ventricle does not have any original wall motion abnormality. So this is isolated case of right ventricle myocardial infarction. Thank you.